Welcome, I'm Catherine Hadro, and this is EWTN Pro-Life Weekly. COVID questions: how is the coronavirus pandemic impacting abortion numbers and women in unplanned pregnancies? We discussed. Love your neighbor as yourself. A medical doctor explains why caring for ourselves and others right now is important in building a culture of life. A tough call. 40 Days for Life ends the public vigil portion of the spring campaign due to the coronavirus. 40 Days for Life President Shawn Carney explains the decision. Ohio's Attorney General has ordered abortion facilities to halt services as a way to conserve medical resources as the coronavirus pandemic continues to spread. And in Texas, Governor Greg Abbott issued a statewide order to ban non-essential surgeries, which a spokesperson confirms does include abortion in most cases. But elsewhere in the nation, the abortion industry continues to be business as usual. In fact, there are pro-life groups that suspect abortion numbers may be rising as this coronavirus health crisis is coupled with surging jobless claims. In the face of this economic uncertainty, what will it mean for abortion rates and for women with unplanned pregnancies? To discuss this, we are joined via Skype by Lori Szala. Lori is the National Director of Client Services for Human Coalition, a pro-life care network. Lori, thanks for being here. Human Coalition serves and supports over 45 pro-life pregnancy care centers across the country. What are the nurses and counselors at your call centers hearing from pregnant women right now? Is there a trend they're noticing during this pandemic?
Yes, actually, the women facing unplanned pregnancies are already in a difficult situation, and the current crisis is only compounding that stress. Most of the women we are speaking with are hourly employees, and they are facing job loss and financial distress. So there's an urgency in their voice and in their messaging. They are fearful because they have lost their jobs, and the financial burden is so great that they are considering abortion as their only option. They feel hopeless and don't know where to look for the resources.
Lori, is there an example you can share with us of how pregnant women are being affected by the coronavirus pandemic?
Absolutely. The other day, we received a phone call from a woman who was a flight attendant, and she was losing her job during this time and was wanting to abort because she was going to be out of work and in financial distress. Said she didn't believe in abortion, but here she was considering it because of this situation.
Lori, it is a very uncertain time for our nation right now, for our world right now, including economically. Some experts suspect we're entering into a recession or even possibly a depression. What should the pro-life movement know about how this will impact women in unplanned pregnancies?
That we need your prayer now more than ever. These women who are calling and who are struggling need resources. They need our support, and they need to know that there are people out there who are willing to help and walk alongside of them.
And finally, Lori, if there is a viewer who is watching right now who has an unplanned pregnancy and she's scared about her future and her baby's future, what do you want to tell her?
You are not alone. There are people here to support you. There are resources to help you through this pregnancy and during this time. This time is going to pass very soon, but we are going to stay beside you, walk with you throughout your entire pregnancy, and help you in any way we can. Just give us a call. We'll be here.
Lori Szala, National Director of Client Services for Human Coalition, thank you for being a light and a hope right now.
Thank you.
To continue this conversation, we now speak with Dr. Sandra Lee. She is a senior fellow and director of life sciences at the Charlotte Lozier Institute. She joins us via Skype. Dr. Sandra Lee, abortion is never necessary to save the life of a mother. So how is it that any abortion centers are staying open right now during this pandemic? These are non-essential services.
No, you're exactly right, and it's a fantastic question. And this is really just another example of how the abortion industry is truly never interested in the preborn and inpatient health. but they are really only directly focused on the intentional destruction of innocent life. Abortion, as you know, is not healthcare, and it is definitely not an essential procedure. And so there are even abortion clinics that are defying state orders and staying open. By them continuing to do so, their continued operation just further depletes the sorely needed resources that we need right now to help patients in real need with coronavirus. And we know that abortions can lead to complications. And then that will just further overwhelm the already overextended emergency rooms. So the abortion industry is just compounding one crisis with another by continuing to stay open, and it is wrong.
What does this reveal to us about the great need for our pro-life pregnancy care centers right now?
It is so important that pregnancy care centers stay involved, and that pregnant women really understand that they are an excellent resource right now to get some very important information that we actually want to share with you right now. So the good news is, based on our extensive research analysis of current data coming out of China, for women that are pregnant and have COVID-19, that there are really 5 facts that I want to share with you. That 1, pregnant women do not appear to be at a higher risk of infection compared to the average healthy adult. As you know, many of the people that are at highest risk are greater than 65 years of age and also have some underlying illness issues such as diabetes or lung disease. And what's important, too, is that there's no evidence of vertical transmission of the coronavirus, which means transfer from the mother to the baby during pregnancy. And this is unlike other viral infections, such as Zika or the Ebola virus. And so what this means is that if a mother does have COVID-19, when she delivers her baby or has her baby, the very unlikely chance that she will have given that to her baby. It's also important to note that there have been no cases of maternal deaths to date in pregnancy for women that have COVID-19. There's also women that are infected with the coronavirus during pregnancy actually go on to deliver live babies. And also, there have been no deaths from coronavirus in neonates to date. It's important to note that some of these babies that are born appear to be healthy. Others are having some perinatal complications, such as shortness of breath. But what's important to note is that these babies that are being born are not testing positive for the coronavirus. So any perinatal complications, and there's actually even one case that the infant died 9 days after birth, that there's no evidence that it was directly associated to the infection from the mother. And so we really encourage mothers that are pregnant right now and either are concerned of getting the coronavirus or have the coronavirus to keep their babies and to really seek out these pregnancy care centers that can provide some really important support during this uncertain time.
That is absolutely important information we want to get out there. I also want to get your reaction to something else. There was an article in the Washington Post last week which claimed President Trump's ban on aborted fetal tissue research is blocking a coronavirus treatment effort. The article states, quote, "The inability to pursue these experiments on the coronavirus is the latest example of disruptions to scientists' work caused by the administration's restrictions on research involving fetal tissue." Can you respond to this? Is this true?
I can respond to it, and I can tell you very emphatically that it is not true, that this article was really playing on the fears of the American people right now during the coronavirus crisis. This story was blatantly misleading and exaggerated. So the fact is that no lives are going to be lost because these few scientists cannot obtain and use tissue from aborted babies. And so these scientists, I just want to back up and explain a little bit what was going on. The scientists wanted to exploit the current coronavirus situation in order to receive an exemption from the HHS rule made back in 2019, which banned them from using federal taxpayer dollars in order to conduct their research using tissue from aborted babies. They now wanted to be able to obtain some what are called humanized mice that have a human-like immune system from another laboratory. And these mice specifically had they had tissues they had the livers, the thymus, and the lungs from aborted babies in them. And so they wanted to use these mice to test potential therapies. They weren't even going to develop new ones. And what's also important is that these mice that they wanted to use, these mice had only been published in one time, and there was no evidence to support that these mice could be infected with a specific strain that is affecting, right now the pandemic, the COVID, the one that's causing COVID-19. So we don't even know if the studies that they were proposing would in fact work, let alone be able to be used to screen for potential therapies. So we really encourage scientists right now that are stating that they need these tissues, that they don't, and that they should focus on the many numerous alternatives that are out there, including humanized mice that can be made with ethical alternatives such as cord blood and tissues from other surgeries that are normally discarded. And, in fact, for the coronavirus, right now there are over 60 potential treatments that are in development that do not rely on body parts from ongoing abortion. So
that's such important information. We are so grateful for your expertise and insight. Thank you so much, Dr. Sandra Lee of the Charlotte Lozier Institute.
Thank you.
As the nation and the world fight the coronavirus pandemic, Planned Parenthood continues to perform and promote abortion, putting women across the country at risk. At a time when protective medical equipment like surgical masks are scarce, Planned Parenthood continues to use them for life-ending instead of life-saving procedures. Now more than ever, we need to come together to stand up for the protection of every human life that is threatened, including the unborn. Health and Human Services Secretary Alex Azar has consistently worked with President Donald Trump to ensure the administration's pro-life policies are upheld during this time. Secretary Azar is a strong defender of conscience protections and religious freedom and has worked hard to keep taxpayer money from funding abortion procedures. We want to thank him for standing up for life and encourage him to be vigilant and protecting the unborn in the face of the coronavirus pandemic. We are praying for him and for all leaders who are working to keep Americans safe and healthy. And that brings us to this week's call to action. Go to ProLifeWeekly.com to thank Secretary Azar for his strong leadership on life and to ask him to continue to protect the unborn during this coronavirus crisis. Once you get to our website and type in your information, your pro-life message will go straight to Secretary Azar. Again, we need to thank Secretary Azar for being a strong defender of life and ask him to remain vigilant in the face of this pandemic. Send your thank you message by going to ProLifeWeekly.com. If we had to look for a silver lining in this coronavirus pandemic, one might be the fact it highlights society's need to come together to care for our most vulnerable. To discuss this, we are joined via Skype by a Catholic medical doctor and the founder of Modern Mobile Medicine, Dr. Matthew Haden. Dr. Haden, thank you for being with us. Putting a stop to this pandemic really requires everyone in our nation, in our world, to come together and cooperate with health guidelines. Can you speak to how, when someone stays home, it's not just for their health, but for the health and well-being of their neighbors and loved ones as well?
Exactly. We really do have to pull together to protect the most vulnerable. You may not understand that there's ripple effects. If you catch this and you have mild symptoms, you still may expose someone else who may carry it back to a vulnerable family member, someone with respiratory conditions like emphysema, someone with diabetes, a NICU baby. You don't know the ripple effects and downstream effects that not staying home can have if you do pick up this virus.
This pandemic really counters the claim that it's my body, my choice, because we are seeing how decisions with our bodies impact others. And by practicing social distancing, that's really upholding the dignity of others' lives too, isn't it?
Absolutely. It's a small sacrifice we can all make that reflects our values, that we do respect the dignity and inherent value of every life, not just our own. So we do ask people to make that small sacrifice and understand that every life has value and we have to do everything we can to protect it.
Absolutely. You know, Dr. Haden, it seems the coronavirus is impacting younger people more significantly than we originally thought. But earlier on, it was common to hear people dismiss the coronavirus because they thought it only impacted the elderly. Can you speak to why rhetoric that dismisses the dignity of the elderly or immunocompromised is dangerous?
Right. It goes back to the inherent value of every human life, and we shouldn't be assigning value to people based on stage of life, health condition, ability, or disability. Every life is important and has an inherent dignity and value for us as Catholics, and hopefully in the eyes of every human being. And we do all have to pull together to protect those lives. We sort of got behind the ball. We were a little casual early on and didn't realize the threat this posed. And now we're playing catch up. So the more aggressive we get now, the quicker we can end this, the quicker people can get back to work. We really do need to make the sacrifice now and be aggressive about stopping this.
Dr. Haden, how can the pro-life movement support the medically vulnerable during this pandemic?
I think it's important to look out for your loved ones, your neighbors, your fellow parishioners who might be vulnerable and shouldn't be leaving the house, who it might be more risky to go to the grocery store and get supplies. And if you can pick things up for them and leave them outside their door and not have contact with them, that is something you can offer to them. You know, we do have a graying of the priesthood and of the parishes and the pews, and it would be nice if people look out for our priests, for your own pastor, and make sure they're taken care of, and anyone that you know has any health issues.
These are really beautiful ideas. There's been an uptick in telehealth because patients don't want to risk getting sick by visiting a hospital. Your patients don't have to worry about that because you come to them. Dr. Haden, can you tell us about the vision behind modern mobile medicine and its truly pro-family approach?
Right, sure, I'd be happy to. I really designed my practice to make it as convenient as possible for families with children to get their medical care. There's so many difficulties and pain points with the regular system, and families are bouncing back and forth to urgent care in the doctor's office. So we offer our care through house calls and telemedicine. So we've done telemedicine from the beginning. It's part and parcel of everyday care for us. It's just part of medical care. It's nothing new or unique for us. So during this time, our patients have really been fortunate that they're familiar with it. They don't have to leave the house. If they have a small need, they can reach out to us. I spend my days now responding to all those requests by text, video chat, phone call, and then if we absolutely need to, I can see them in person.
That's beautiful. And can you give us a quick example of how families really benefit from this practice?
Sure. You know, right now we're handling as much as we can virtually. That's the recommendation from the CDC, so that I, as a doctor, don't end up inadvertently spreading the virus. But some things do need to be seen in person. So I had a family yesterday with an injury, a deeply embedded splinter in their teenager's knee that they couldn't get out themselves over the weekend, and they drove over an hour just to avoid the big health centers, the hospitals, the urgent cares, that they didn't want to be exposed to the virus. So they came to my small office, and I was able to help them out in that need.
That's incredible. Thank you so much for joining us and for your insight. Dr. Matthew Haden with Modern Mobile Medicine, thank you.
Thank you for having me.
Coming up, the president and CEO of 40 Days for Life says he had to make the toughest decision yet in his role. We check in with Shawn Carney, president of 40 Days for Life, to hear why he ended the public vigil portion of the spring campaign amidst the coronavirus pandemic. Welcome back to EWTN Pro-Life Weekly. I'm Catherine Hadro. As restaurants, bars, and public venues close all over the nation to prevent the spread of the coronavirus, Planned Parenthood is still open for business. That is this week's Speak Out segment. The nation's largest abortion business is not letting a pandemic stop them. Many Planned Parenthood facilities are still committing abortions. The acting president of Planned Parenthood, Alexis McGill-Johnson, wrote in a tweet, quote, "To our Planned Parenthood community, know that in these uncertain times, we're here with you. We're going to be here in every way we can to provide the health care and information you need, no matter what." Of course, we know that abortion is not health care. Even though Planned Parenthood likes to call itself a healthcare provider, it is unequipped and unwilling to help patients impacted by the coronavirus. In fact, the abortion industry is preying on women and unplanned pregnancies right now, profiting off of the fear that comes with economic uncertainty and a global pandemic. Even though abortion is not an essential service, it is never necessary to protect the life of the mother. Those running the abortion business just cannot resist the opportunity to make a buck. And at a time when the world is coming together to protect the health of our most vulnerable citizens, Planned Parenthood continues to target the vulnerable in the womb. While Planned Parenthood might be open now, we should continue to pray for the day it closes its doors forever. Over the weekend, the president and CEO of 40 Days for Life announced he had to make his toughest decision yet in his pro-life leadership role by deciding to cancel the public vigil portion of the spring 40 Days for Life campaign because of the coronavirus pandemic. The vigil portion entails nonstop, round-the-clock prayer vigil outside of a local abortion facility, but that will now come to an end. 40 Days for Life says it's been monitoring the COVID-19 outbreak since the beginning of the year and is now ending the vigil portion for the safety of families and volunteers. This comes after they had already been limiting pro-lifers to fewer than 10 volunteers at a time. 40 Days for Life is a campaign that advocates for prayer and fasting, vigil, and outreach outside of abortion facilities to bring an end to abortion. The spring campaign runs through Palm Sunday, April 5th. For this week's Pro-Life Focus, we are joined now via Skype by Shawn Carney, President and CEO of 40 Days for Life. Shawn, welcome. First off, I know this could not have been an easy decision. Walk us through how you decided to cancel the public vigil portion of the campaign.
Well, it's the last thing I thought I would have to do this spring. Certainly not something I ever want to do again and didn't want to do this spring, but it was time. We had been monitoring the outbreak since back in January and throughout February. I was very proud of our team, and it continued to spread. We modified, we adjusted to meet the criteria for the CDC. And, you know, we're in over 30 countries. We had 507 cities. And as all the different restrictions came about, both regionally here in the United States and certainly around the world, we just came to the conclusion it was time to go. I'm glad we made it as long as we did. We had a lot of saves. The saves were actually up this year compared to this time during the last spring campaign in 2019. But, you know, for safety precaution, we hit the time where it was time to close the vigils.
Well, speaking of taking safety precautions, Shawn, I understand there was a recent incident outside of a Planned Parenthood in Pittsburgh. What can you tell our viewers about that?
There was. It was something that even surprised me. And usually I'm not very surprised by what Planned Parenthood does. But we had a sequence of days where we had some pro-abortion people going out and coughing and sneezing on our volunteers. And we ended up hiring security at that location, full-time professional security, and another location. We'll have to do more of that in the fall 2020 campaign for sure. But one of the people coughing on one of our prayer warriors was a Planned Parenthood worker who coughed on her, gave her the middle finger, and then went inside to work. It was absolutely shameful. And so we took all the precautions, and those 4 volunteers that were part of that sought out COVID-19 testing. And it's even surprising to me. I mean, we've helped 196 abortion facility workers. We would help this one. But we're asking, in my opinion, she needs to be fired. She has not been fired yet. Any other company, given the coronavirus pandemic, they would have had this person fired immediately. It's absolutely ridiculous.
Wow. And Shawn, the vigil is truly the public centerpiece of 40 Days for Life, but it's just one portion of the campaign. What are other ways pro-lifers can participate in the campaign and help to bring an end to abortion?
Yeah, I think now more than ever, you know, I preach a lot and we preach a lot that this is prayer and activism, but we know that the contemplative always has to come before the active. And we are learning that now more than ever by no longer having the physical vigils these remaining days. And so it is the foundation, is prayer and fasting. We're doing that from home. We have the daily emails and updates. We're still giving vigil updates because we have so many from when the vigil was going on. We have daily prayer intentions. And I launched, once we did close the vigils, a daily video blog where today we announced an abortion doctor in Mexico who just had a conversion and is leaving his job. And so we started the video blog. You can find that on YouTube. And, you know, there are so many ways that we can be praying. You're right. We are united. We're together apart, as the hashtag has become. And it's a beautiful thing, but that is our most powerful weapon against the devil and against the abortion industry. And of course, we would love to be out there still, but it just wasn't possible. But what is possible is praying and fasting as we head into what should be a beautiful Easter after a very difficult Lent.
Amen to that. Yeah, your reminder of prayer and fasting is perfect for this time of Lent. Thank you for being a light and a hope. Shawn Carney, President and CEO of 40 Days for Life. Thank you.
Thank you.
That does it for this edition of EWTN Pro-Life Weekly. I pray you all continue to be safe and healthy at home. We'd love to hear from you right now. If you have an idea, a question, or a comment, let's connect online. Find us on social media at EWTN Pro-Life, and you can always send us an email at prolifeweekly@ewtn.com. Until next week, remember, life is a gift. Your life is a gift. God bless.